Has your doctor told you that your labs are normal, within range, but you don't feel normal? You don't feel right? This is a question and an answer really that I get quite often from my clients who've already been to their doctors and have had some blood work done and are being told that everything looks fine, and either they don't have a problem, it's in their head, or they're just getting older. When we talk about why is your doctor telling you that, it's helpful to understand the difference between conventional ranges, which are really wide. I call them black and white ranges. You're either sick or you're fine. When your doctor's telling you that everything's fine, they're being honest. Based on their lab ranges, the markers that they tested you for, which usually are more superficial, meaning not looking at deeper causes for why you're having symptoms. So doctors run very basic lab work that insurance will pay for that helps that doctor diagnose and prescribe at a symptom level. But when we're working at a root cause level and we're trying to actually figure out what's causing your symptoms, we need to run a little bit more in-depth blood work to start to figure out what's causing things. And so conventional ranges are made in every state, in every county, in every city in the country. They're actually composed of people going in for blood work, and they're making a bell curve out of it, and they're establishing their normal ranges based on that. Well, who's going to the lab to get blood work? People that are healthy, people that are unhealthy, right? It's usually people that aren't feeling well that are more unhealthy. So that's often why you're getting answers. If you're not really far out of range, everything will look fine on your lab test. But the bigger issue is there's more than one lab test. So in functional medicine, we actually use a narrower lab range. I call it the shades of gray. These ranges are established by the American Association of Clinical Chemists, so a bunch of geeks in a lab, and they essentially determine what optimal human function is objectively through blood markers. And so in functional medicine, we use optimal ranges that are narrower than your standard range, and there are different optimal ranges too, but more or less they're similar, just like more or less conventional ranges around the country are similar. Something in the functional range, it may not be in functional range, it may be in a conventional range, but it hasn't gone outside the range yet, so your doctor hasn't mentioned it to you as a problem because it's not outside of their range. But often we're seeing a lot of folks who are struggling with symptoms, not feeling well, have been told already by docs that nothing's wrong. Their ranges are here, but when we have to actually do their blood work, we see a lot of problems already. And a lot of it's just due to the labs that are being run, and the complexity and the comprehensiveness of it is giving us more clarity. You'll never usually hear from me that it's all in your head. You're just gonna have to get used to it, because we always know why you're not feeling well. When we run the right labs and we get to the root cause, we can definitely help you understand why you're having the symptoms you're having.